So as part of the safety check for the patient, we will come into the ward with our trolley, and in the trolley will be an array of options to assist individual patients. Now, different to the disposable bundle, these items are patient specific. We will just leave what's needed or what the nurse or physiotherapist would like for this patient. And most of the items are to be returned, except for the Panna sling, but the other items can be laundered and reused. So if we go through the key items in the bundle, first up we have the bed ladder. Now the bed ladder attaches to the end frame of the bed at the foot end by threading through itself, coming back up to the patient and lies beside the patient, and its intended use is for the patient in bed to actually be able to pull themselves up the bed, sit up, and then let themselves down. So I just recall Tracy Carr, our bariatric consumer, one of the things she said, the number one thing in bed for her is being able to actually hold on to things and move around inside the bed. And just a point on that, remember that these bedsides here are made for patients to use as well for in-bed mobility. So keep that in mind when you're advising or supporting customers. The next item I'd like to go over is the Panna sling. Now this here, the Panna on a bariatric patient is obviously their stomach overflow, and this item here can help hold the Panna area up. These straps here can strap to the bedsides or can be held by the nurse or patient. And by holding the Panna up, it provides far greater area for hygiene and cleaning for the nursing. Keeping in mind that this is also an area of great risk to the nurses when they're holding the patient's Panna up, often that will be a source of injury. So the sling is a really key part for the patient to be involved in their own care and also retain independence while reducing risk on the staff. So the final item I'd like to show that we normally do on the in-bed mobility, leg lifter. So the leg lifter is a product that the patient can use to lift their own limb into bed. Now, to use this correctly, we advise they put the bed on the lowest setting possible by using the end controls, so the patient has the minimal distance needed to bring their leg into bed. There's a few variations to this. There's the leg lifter that comes around the leg. This one's a really good one. It's got a stiffening area. It's got multiple handles. But generally on the cart we will have 2 or 3 different options to suit that particular patient. So that's the 3 main items in the trolley that a lot of patients will use: the bed ladder, the leg lifter, and the Panna sling. Outside of that, we also have a range of other items to help with care. Here we have a firm wedge. This is helpful for positioning the patient, maybe taking some weight off some area that they need to attend to. It can go under their leg, it can go under their back. Another very helpful item, that if the patient has injuries on their heel or on their hand, this here holds that limb up for the nurse to actually be able to care for the patient. So that's also on your cart. We have a couple of, it's a cooling sheet for the top of the bed for patients that are feeling overheating in hospital, and then we've got a turn yourself sheet which some hospitals will require. Probably last but not least, there's a very key item here called the right height tool. So this right height tool has an adhesive back, and it should be positioned with this armrest, with this side rail rather, in its upmost position, and you line it up with where the leg brake of the bed breaks, and you affix it to the side rail, and when the patient, you can then extend it out to the length of the patient's legs, drop it, and that's the height the bed should be left at. And what you'll find surprising or interesting here is this will generally be a lot lower than the nurses normally would leave patients. But the correct height for a patient is from their knee down to their foot. So this here is a way you can actually measure that in bed and get the right height for that bed, leave the bed at that height, because that's critical to the patient's mobility, that they can, if they're able to get out of bed, they're able to have the bed at the right height. So that sums up the gear that's within the in-bed mobility kit. Thank you.